The recovery movement is quite a history for the Mental Health Association of Southeastern Pennsylvania. Uh, when we first started organizing as an organization, self-help groups and mutual support groups, and eventually peer-run or consumer-run organizing efforts, we didn't really even use the term recovery. We mostly talked about the idea being a voice and empowerment. We talked about it primarily as an empowerment movement. The idea was that people who had diagnoses of mental illness, who for the most part had been treated in mental hospitals, needed to be and should be living in the community, and living in the community with their full dignity and fully integrated in the community. And those of us with diagnosis, I have a diagnosis of bipolar disorder, began to do some organizing. We began to come together in small groups. Back in the 70s, the original organizing efforts had some pretty radical names. They called themselves the Mental Patients Liberation Front, or the Front for the Liberation of Mental Patients, because the idea at the time was growing pretty much out of the civil rights movement, the 60s and 70s, and the idea that discrimination was what kept people down, kept people from realizing their full potential. So those were the early days of organizing. Some of us who weren't quite as anti-psychiatry in our approach, but had more of that what we needed to do was get involved in reforming the system, making the system more responsive to the individual, but still basically a system of mental health care. Started calling ourselves the consumer movement. And we use the term consumer because it came from the idea of, like Ralph Nader's consumer union, the idea of people who had choices or were trying to make choices when it came to the services that they utilized or consumed. Other names that we now use are peer support and mutual support, the mental health clients group in California. So there are different names that people find to use. But the idea in history was one of asserting our civil rights and organizing for civil rights. Here in Philadelphia, the Mental Health Association of Southeastern Pennsylvania basically looked around in the early 80s and saw that the family movement was organizing and getting pretty well organized, but there was very little in the way of organized self-help and mutual support activities for people with a diagnosis of mental illness. On the alcohol and substance abuse side, there were things like AA and Al-Anon and Narcotics Anonymous and other groups. But on the mental health side, there was very little except for professionally provided services. So the Mental Health Association began to look for a model to see ways that we could get organized. In New Jersey, where I was working at the time, we'd been organizing self-help and mutual support groups throughout the state of New Jersey. And the Mental Health Association here in Philadelphia thought that would be a good idea. And I began to work with them, and we wrote a grant and eventually got funding from the city of Philadelphia to hire one person, myself, to begin to organize self-help and mutual support groups throughout the city. Well, that took off. That was really something new and exciting, and people were very interested in it. And we also began to do advocacy. We felt not only did we need to come together in mutual support groups, but we needed to have that unheard voice of people with mental illness heard. So we began to organize advocacy groups around issues like homelessness, around discrimination in public housing. So we had a pretty active organizing effort. And we played a role not only here in Philadelphia, but we helped organize the first national organization called the National Mental Health Consumers Association. We also organized the National Mental Health Consumers Self-Help Clearinghouse. So in many ways, Philadelphia was sort of an epicenter for social activism when it came to the issue of mental health and recovery. Recovery came along with the idea that not only do we need to have a voice against stigma and for social change, but the way mental health services are organized, the way the system actually provides services can either be a help or it can be a hindrance to the individual. And the way it can be a help is by encouraging recovery. And you're going to hear some today about what goes into the recovery model and organizing a program and organizing services, whether they're consumer-operated services or professionally operated services that are recovery-oriented. And this, again, grew out of the history of the ideal people coming together and uniting and having a voice. Sometimes in the early days, it was only a handful of people, literally in about a dozen cities, there were a handful of people coming together and saying that civil rights were being violated. And we needed to organize and say that people's rights need to be protected. And included in those rights were decent services that respected the individual, that looked at the person as an individual, that gave people choice. One of the biggest issues in the early days that we were organizing around was the idea of choice, and literally freedom, because for the most part, mental health services in many ways are very coercive, and pretty much involuntary treatment was more the norm than not. A lot more then than it is nowadays, where most people were treated in inpatient facilities like state hospitals, where of course their freedoms are extremely limited. So we wanted to get people out of state hospitals. One of the big things in the early days of the consumer movement, the recovery movement, the patients' rights movement, was to say that we needed to integrate people into the community and have community care for people. So that was one of our big issues, was community integration. And what we did to do that was speak out. We began to speak out. We literally there were programs around the country that had speakers bureaus where people in recovery would go out and speak to citizens groups and public groups, just to kind of raise consciousness about the fact that people with mental illness can and should be living in the community and should be treated with respect and dignity. We also began to organize, and we had one of the very first national conferences, which today has grown to be the Alternatives Conference, which we're going to be having very shortly soon in Omaha, Nebraska. And that was the first time we did that, was in 1984, and we thought we'd have maybe 50 or 60 people, and we ended up with over 500 people gathering in Baltimore. And now we've had 23 years of organizing alternatives conferences, and this organization, the Mental Health Association, through its National Mental Health Consumers Self-Help Clearinghouse, big name, has played a major role in organizing these conferences all over the year. So the history of recovery comes from the fact that if we really look at what people need, individuals need, one thing is we want to shape programs and services that are looking at the individual. Treat the person with dignity, treat the person as an individual, and give them as maximum choice as possible. The other thing that we're looking at in recovery, and historically we've looked at, is that how can we expand choices? How can we make it possible for people to have more than one choice? When we look at mental health systems of care around the country, many times people have one choice, to go to one doctor or one mental health agency or one clinic. So organizing self-help groups and mutual support group, one thing is gives people another choice. So that's one of the things we started looking at, was how could we kind of break out of just doing the medical model, the system as it's always been, and create some alternatives. So we began to create alternatives to the sort of normal medical model way of doing things. And many of those alternatives developed into the consumer-run and consumer-operated programs that we see around the country, and that we definitely have here in the Mental Health Association of Southeastern Pennsylvania. So recovery is not just a concept that we're trying to do something different or new, but it really grows out of it's a movement. It's a sense of change. It's a sense of social responsibility as well as rights. And our hope is that we can continue to grow that and become even better at providing recovery-oriented and advocacy-based services for people here in Southeastern Pennsylvania.